One of the things you should know as a parent is if your child, your toddler, your infant is snoring, that is not okay. It's not normal for children to snore. And if you have a child or infant that is snoring, you need to get them to a physician for a consultation, and you need to do it pretty quick. Why? Because there's a lot of things that can be going on. A child could have upper airway obstructive syndrome, enlarged tonsils or adenoids, all leading to a deficiency in oxygen. And also it can affect the way that your child's jaw and teeth develop. So I'm not talking about if they have a cold, but if there's a normal activity of snoring, please take your child, your infant, your toddler, and go get a consult with a physician, a dentist, whoever, and make sure you find out what's going on.